And welcome back once again. If you suffer from chronic neck or back pain, the DRS protocol might be the thing for you. Dr. Drew Mcphail joining us now with one of his patients, Patricia Tor. Welcome to the show. But first, tell us, what is this DRS? What is that?
Okay, the DRS protocol, it's a protocol that's designed for herniated disc, bulging disc, spinal stenosis, or failed back surgery. Okay, and basically what we're able to do is help rehabilitate the soft tissues, the discs primarily, the ligaments and tendons that are affecting the nerves and causing most of the pain.
So you're working on rehabilitating what causes the pain.
Yes.
Sometimes that rehabilitation may or may not need surgery, or the surgery that was done may not have been done correctly.
Yeah, and commonly there is what's called the failed back syndrome, patients who have had surgery but still have no symptomatic relief. So what we're able to help those patients as well. Like in Patricia's case, for example, she had a L5-S1 surgery, which is down at the very base of the spine there.
Guys, can we get a close-up shot of this with number one?
Okay.
And you can see the pin there.
You can see the big screws going into the vertebral bodies there. And she had that surgery in 2010, and she didn't make it
the screws right there
to our office until last year. And since then, whenever she presented, she was having severe back pain, radiating pain down her legs. Now she can tell you a little bit about how.
And it was just continuous pain.
Yes, that's the thing. Chronic pain is the worst. Because it wears you down after a while.
It wears you down, you can't sleep. And then when you can't sleep, what little sleep you do, you wake up, you're tired, you're exhausted.
Exactly.
Maybe a little cranky, maybe a lot cranky. Yeah. Tell us what Dr. Mcphail was able to do for you.
In just a matter of months, I got to the point, when I went into his office, I was still walking with a cane. And in a matter of months, he got me to the point where I no longer needed the cane to walk with.
Yeah, because you walked in here today perfectly
fine.
Yeah. Wow. So what sort of procedures did you go through? Was it painless, the procedures that you went through? And how often did you come and see Dr. Mcphail?
In the beginning, 3 to 4 times a week. And then after a couple of weeks, then it narrows down to 3 times a week and then twice a week. And now we're treating another part of my back. We're treating my neck now.
Okay.
Yep. She, with our treatment, it's a multimodal approach. Part of it is spinal decompression. Some of it is the high-powered cold laser, which you're familiar with. And basically, it's all done off of how the patients are improving. The quicker they improve, the quicker we're able to reduce frequency. Some patients, we're able to get them reduced down very quickly. Some of them require a little bit more management.
And with this, when you first started seeing Patricia, initially you talk with her, and then you have some back x-rays. So that tells you everything that's going on. You find there where the pins are, and you know exactly where you can go in and make the adjustments. And this, I've had similar where my lower back was hurting, and to come and see you, you know exactly where to go. You put the pressure. You may do a little turn here, there. You may do a little straighten out, and it's just amazing. Boom, there it is.
To clarify, this is not chiropractic adjustments.
Okay.
Okay. The DRS protocol it utilizes spinal decompression. We have these AcuSpina IDD therapy, which helps to decompress the discs. What happens is when you fuse 2 discs, the ones above it or below it, they begin to wear, or they'll begin to bulge and wear out as well, because each one has a specific range of motion that it's accountable for. So what we're able to do is decompress those discs, which gets the pressure off of the nerves, which relieves that sciatic type pain.
Appreciate you correcting me on that. How do you decompress the disc? Okay,
we have we have these large machines. It's very comfortable for the patient. What they do is they stand on a backboard, and then it lays them back. Once they do, we have a harness that's around the pelvis and around the torso, and it just gently decompresses them. And we're able to apply a focus force specifically at the level or levels of the spine of which we're working with. It's not like a general traction that just yanks on everything. We're able to focus the force right
sometimes
there.
You got to go through things very gingerly instead of, you know, the hard cracking. I bet it was just like, wow, this just feels so good.
It amazed me.
Yeah.
I didn't believe that there was any kind of treatment out there. I'd been through so many different ones. I didn't believe there was one that didn't involve injections and pills.
Sure.
And so I was amazed but very relieved, because that's what I was looking for.
Well, that's what Dr. Fell did. You went to the source, what was causing the problem, instead of medicate.
Thank you.
You know, and that's what so many of our doctors should be doing. What you're doing is finding out what the problem is,
and
go to the source,
yes,
and go, listen, we need to straighten that, we need to decompress, instead of throwing all these pills and everything at you.
Exactly.
What other sorts of treatments can be done with these problems?
With these types of patients, post-surgical patients like this, we can use our MLS M6 laser, which is that high-powered cold laser, which will go in and basically it stimulates cellular repair. It also gets the inflammation out of there really quickly. Right now, since we've gotten her low back doing so well, she has arthritis in her cervical spine and her neck, which was preventing her from being able to turn her head to look out of the back of her car.
Now,
Looking good. Looking
no
good.
problem at all.
We're out of time. Thank you so much, Patricia, for coming in.
You're very
Appreciate it,
welcome.
Dr. Mcphail. Thank you very much.
Good to see you again.
Always very informative and putting patients in the right direction. That's for sure. Got more coming up in just a moment. Make sure you check them out. 1709 Old Trolley Road.